trying to send this out and it's giving me all kinds of crazy things. Hello. There we go. Hello. Welcome in, welcome in. Share out the live. Like the live as well. This is the info session for, oh, thank you so much. Oh, how sweet. This is the info session for the Intro to Holistic Medicine spring session. So if you were interested in learning more information about our class will begin next week, February 6th. I literally just posted a video on all the platforms with the syllabus and the course materials that are required. It is a 12-week class, and so it's broken up into 3 parts. The first part is foundations. We're going to talk about data and how we take data. We'll do subjective data and objective data. Subjective data is pretty much what our patient tells us, so we'll use both motivational interviewing for that as well as a questionnaire, and so we'll use that to be our subjective data. And then for our objective data, we're going to use 3 markers. We'll do salivary pH, urinary pH, and heart rate. So we're going to use those 3 markers, and we're going to pretty much test our bodies and see what's going on with our bodies and begin to learn more about our system. So this is an intro level course. We'll talk a little bit about the foundations of holistic medicine so you have an understanding actually what holistic medicine is, because it is a unique practice. Holistic medicine, we look at all aspects of a human being. So it's not just physical. We look at physical, we look at environmental, we look at mental, emotional, spiritual, as well as ancestral. And we look at those components of a human being from both subjective and objective perspective. So that is the strongest type of study, a mixed methods approach. So that's our first part, our foundation. We're not going to look at all those metrics naturally, but just so you're aware of the depth of holistic medicine, because I think there's a lot of confusion in terms of what it is, because people will use that word for all sorts of different style practices, right? So holistic in and of itself is whole, right? So we can't just pull one piece of the whole out and call it whole, right? We look at it in a combination. There's no one thing that makes up a whole. There's all these combinations of things that make up the whole. So we're going to look at the scientific aspect of it in the first part. Then the second part, we're going to get into the modalities, which is a lot of what people think holistic medicine is. And when we're talking about modalities, we're talking about using nutrition. We're talking about using movement, mindfulness practices, in addition to a little bit of remedies and things like that. So we won't get a lot into remedies, but because there needs to be a greater understanding of how the body works in biochemistry. So that we will explore that in the second part of the course. And then the third part of the course is where we're really going to really integrate that information. You'll have your data. You'll also, have your modalities. And those modalities, I'm going to teach you how to actually move the data in different directions. So not just, okay, these two things, but you'll actually see the connection, because that's what science is. It's a scientific process, right? And so, hey, Cruisin', the scientific process is this, the patient comes in, we listen to the patient, what the patient's concerns are. We have a hypothesis, which is just an educated guess. And then we're going to use an objective tool, something outside of me, something outside of you. We put all of that together, we create a treatment plan. And then from there, what we're doing is we're checking the treatment plan to see if it actually works. So again, it's a 12-week course broken up into those 3 sections. There is a technology fee. It's $39 for the 3 months, and so that's all. You can pay it in full or pay it on a monthly basis, and that really goes to the course shell. So you'll have a course shell where you can do your discussions and put all of that information. The recordings will also be housed there, so if you can't catch the class live, the recordings will be there. The recordings will not be available for you if you are not registered for the class. So if you want to register, please click the link in the bio. It says Intro to Holistic Medicine. Click on that link, fill out the form, and then I'll organize it. I'll kind of go through them and that sort of thing. I noticed there were a couple questions that were kind of a little funky. I apologize. I'll correct it later. But nonetheless, so you will need pH strips for this class, a heart rate monitor. I recommend Notion as well to organize everything that you need to complete, and we'll use that. So those are the things. You'll have downloaded 2 apps on your phone. One, so you'll need to make sure you have a space for that. One, to track your data. Now you can do it on the computer as well, but it's much easier if you have it on the app, because you'll be taking your pH levels, you'll be taking your heart rate. And so if you have like an Apple Watch or a Fitbit, that will sync up. I got this one a few months back to kind of test it out. It was literally $20 on the TikTok shop, and it hooks up to your Apple Health, and your Apple Health will sync with the app. So that's, a pretty inexpensive way to do it. And so we'll be putting those markers in the app, and then over the week you'll be checking your data, and I'll give you kind of weekly snapshots of your data from my end, and we'll evaluate individual data, and then we'll obviously see what you're doing, and then go from there. What we're looking for is aspects of the digestive process, so upper GI ability to break things down in your pH levels, as well as oxidative stress and how your body is detoxifying. And then we'll also be looking at stress and how stress impacts your system. So that's a little bit about what we'll be at least looking at objectively. And so, yeah. Let me know if you guys have any questions regarding this class. Like I said, I did just post a video that goes in depth into the syllabus and all of that. So please share, save, repost that video for me, just so that we get it out to people that are interested in taking this class. I'm trying to figure out how all the people that have been saying they're interested, I need to kind of figure out a consolidated way to reach out to those people. So I've just been trying to go live a couple times a day. So I'll be alive for about an hour, and then jump off because I have meetings and whatnot, and then I'll be on later this evening. So to answer any of your questions. So so it's a 12-week course. After it, you get a certificate of completion. I actually do have a school for holistic medicine that I'm building and growing. So if you want to continue on there, we will go into a holistic medicine consulting or consultating certificate. And that is a year-long course, but you don't have to do the whole year. You can do different courses, like we're doing Intro to Holistic Medicine, and there'll be other courses that are further down the line. So, yay! So that is that. I've been in this field for a long time. I absolutely love it. It's just been a real passion of mine to help people in this way. And with the advent of, current administration public health blackouts, the need for having your understanding your own health data is going to be just that much more critical. And so we also want to look at it from multiple perspectives. So, back when I, first started, we started doing things. Yay, very cool. Yeah. Oh, I'm so glad. Yeah, you were one of the people who said they were interested. So I'm glad you were able to catch me live. Let me know if you have any questions, for sure. And same goes with anybody else who's watching on any of the other platforms. So, what we do is we build this foundation of understanding of science, right? Because also too, that's how we know if things work or not. We don't guess, we test, and we don't want to assume something is working. We actually want to test and make sure, which, I'm not a supplement salesperson. We do use supplements as medicine and as treatment, but that's not the forefront of what we do. Forefront of what we do is really public health education and patient health education and patient health advocacy, and making sure that patients have true informed consent, meaning that they understand, what their treatment options are. Part of having informed consent is fully understanding your body, what's going on with your body, what treatment options are available, what the theories were, or the methodologies that a doctor gets to, or a practitioner gets to that understanding, and then various options, meaning like even in my practice, I understand. I'm trained in integrative medicine, so I have understanding in conventional practices, and if conventional practices are needed through therapeutic order, we make those recommendations. So in the first foundation course, we talk about therapeutic order, and so we talk about what needs to happen first, because if we don't have a proper therapeutic order, there's no structure for clinical treatment, and then we don't really know if we're making any progress or not, and then what is the absolute point? So my motivations and my desires are really to help people, and not necessarily, help them from a profitable perspective. I mean, although holistic medicine has done very, very well for me in my career and field, I've been very, very successful and blessed over the last 20 years. And I will, if you continue on, I will teach you obviously about the business of holistic medicine and how to do it in an ethical way, because I do see a lot of unethical things happening that are called holistic medicine, but are not necessarily holistic medicine. So we want to make sure we clearly define what holistic medicine actually is. And what it is we're looking at all of these aspects of self, all of these aspects that make up a human being. So we look at the physical aspect, right? So, your physical foundation, how much water you're drinking, your movement, your, breath work practices, those sorts of things that are going to affect your physical body, right? That are going to affect your bodily system functions. And then we look at your environment, because let's face it, if your environment isn't an environment to which you feel safe in, or to which you feel healthy in, or to which is triggering to you, that is going to impact and affect your nervous system, and it's going to impact and affect a lot of different things, your immune system, etc., hormonal system, etc. So we look at the environment, simply, even if there's mold in the home and you're not aware of that, that is going to have a significant impact on your health. So understanding those aspects of it in terms of the environment. So environment is a very broad term, but we have subjective and objective data to determine what's going on in the environment, not just physically, but also if there's, breakdowns in relationships, if there's lack of communication, there's all kinds of relationship dynamics in a home. And family dynamics. So we do get into family systems theory and understanding the impacts of that. Then we look at mental aspects. So now we're looking at conscious mind, subconscious mind, primitive mind, and how those three minds work together. We look deeper into consciousness and conscious awareness. In terms of, there's lots of different metrics we can use with the mental aspects of ourself, both on the physical realm as well as subjective, so objective and subjective. Then we also will look at the emotional aspects of the patient. Again, we're looking at it more from a perspective of what is impacting the physical body, right? Because we know that emotions that are not processed out will impact the physical body, and as it's impacting the physical body, that creates a process of dis-ease, right? And then eventually that will manifest. So again, we have objective tools. We use a biofield camera to assess where patients may be stuck and may be unaware or unconscious because they've been in survival mode. So there's a fair amount of deconstruction that happens with a holistic doctor, because you're really understanding on a deep level where you're congruent and where you're not congruent. We may get into core values, we may get into self-identity, self-concept, but all of it is really to help you transform as a human being and optimize. We look at spiritual aspects, and when we're talking about spiritual aspects, it's intuition, it's trusting higher self, it's being able to connect with inspired action. So you have a thought first, then it becomes an emotion, then it becomes an action, a habit, a behavior, and then inevitably a lifestyle, right? And there are stages of change that we'll go through. There's 6 of them. So you have that denial, where people just are not willing to change. Then you have your pre-contemplative, where you're thinking maybe there's something here. Contemplative, there's definitely something and I'm actively looking. And then there's the action, where we're in action mode, we're doing a checklist, we're getting things done. And then inevitably there's a relapse. But it's all about really how quickly somebody can be resilient emotionally in a relapse and come back from that without as much stress or impact on the body. So because a lot of times what we'll see is, especially in trauma and complex trauma, is the mind and the thoughts are over here, the emotions are over here. Usually the emotions are in the past, the mind is in the future, and then the body is stuck somewhere in between. And so that creates a lot of nervous system dysregulation, and especially when we assign meaning to the things outside of ourselves, because right now things are going through a big shift, a big destruction, a big collapse, but we know that after every tower moment, there's always a rebirth. So while all of that is happening, right, we must focus on self, because there's really nothing that we can do otherwise outside of ourselves. And if there is, we'll mentally and emotionally, through inspired action now, because we're integrated, right, we're living a holistic lifestyle and we're practicing, right, every single day. So this practice really allows you to inevitably get deeper into your higher self. The last aspect that we look at is ancestry. So we do look at genetics, methyl-genetics, and how that impacts. And also it can get into, again, bioenergetic frequency, quantum physics. So we do expand into those, but we do start with this scientific structure and framework so that you can understand how these sciences really have been practiced and perfected over time. So a lot of the researchers that I've worked with from all over the world, so I am international, and because I've gone to various different places and worked with various different healers all over the world, and really learning all kinds of different practices. So if you're interested in Intro to Holistic Medicine, click the link in the bio and definitely check out the most recent video that I posted right before this live, and it has all of the details for registration for the class. The class begins next week. So all this week I'm doing info sessions, answering any of your questions about holistic medicine, what it is, what we do, why we do it, all the things, how the career looks, pretty much anything that you have a question about. I am happy to answer it. And in terms of what platforms that I'm on all of the major platforms. I am building a website right now for the school. It's actually almost completed. And that way, you can see some of the other course programmings. For me, I'm really focused on more graduate level education. So my focus is primarily on more master's and doctorate level. I do have relationships with Everglades University in Boca Raton, Florida. It is my alma mater, and they have an amazing bachelor's in alternative medicine for someone who needs a bachelor's degree. But while you are, earning your bachelor's degree, you can also work in the field as a holistic health coach with a certification from our school. So that way, and we have a relationship with them, and so that way we can work together and get these credits met, and you can really learn more practical skills and tools about how to actually practice. So I didn't just go through and learn all of the things in school, right? I actually grew up doing this work and practicing it. So it's something that is passed down through my ancestry and my lineage, and something that I bring in a certain type of reverence and structure to, because we are working with other people, and we're working with other people's energies, their mental, emotional, physical states, and we take that responsibility very seriously. We also work to create therapeutic structure, and therapeutic containers to mitigate transference and bias from happening within the therapeutic space. So that's also why we use a lot of the objective analysis as well. So we're not projecting maybe what we think about the case rather than what actually truly is. So definitely, a deeper level of understanding. So if you guys have any questions, feel free to throw them in there. I'll be on live for about another 30 minutes. Answering your questions about our Intro to Holistic Medicine course. While you're considering that, I also go live in the morning, 6 a.m. Eastern Standard Time. I do a morning flow class. That one, you don't have to register. I'll put the registration out there for people tomorrow probably, but that class is just really a drop-in class, and it's 15 minutes of movement, 15 minutes of meditation, 15 minutes of journaling, and then 15 minutes of planning your day. And so we want to be more proactive with our day instead of reactive. We're also doing a prosperity meditation series, so we're practicing for the 6 a.m. For the 6 a.m. morning flow, you can just join in. For the Intro to Holistic Medicine, you'll want to register for that class, just because I need to plan for the people that are in, because I have to get you registered with all the, the course shell and all that kind of stuff, and make sure that everybody's in there. You've got your app and you know how to use it and all that stuff. So, yeah. Yeah, so the morning flow is just a drop in, and like I said, we're working on a prosperity meditation series right now. So I'm trained in several different types of yoga: Kundalini, Iyengar, Hatha, and Ashtanga. And so primarily I practice mostly Kundalini. I do some Ashtanga sometimes too, but mostly Kundalini. And so we're doing a Kundalini meditation, a prosperity meditation for 45 days. And we're working on the journal prompt, Who Am I? And that's building a deeper conversation around self and self-concept. If you check out on my YouTube channel, I just did a whole series on the mind. I kind of didn't do as in depth on the conscious mind as I think I probably, would have wanted to, but it was mostly because I was really giving myself a rest because I was working a lot. And but we went through the primitive mind. We went through the subconscious mind, and we touched on the conscious mind. So understanding a little bit more about the breakdowns with that. So we're working on self-concept and building. This month's content also in the shell, when you get in there, is all related to really connecting the mind and the body. So we look at how to create a holistic mindset. There's a holistic planner. You'll start to learn how to structure your day and really learn how to create your day rather than be at the effect of your day. And that's a lot of what you're going to be teaching your patients, especially when you're working with restructuring people's nervous systems. If and the reason that you do that is because otherwise the brain will continue to be scanning for the next thing, right? But if you start to tell the brain, okay, this is what to expect, right? Of course it's not foolproof, but you start also building consistency and building memory. Now it starts to become with ease, right? Now you're not having to use so much effort, and that's really what it's about. Holistic medicine is all about building optimization and efficiency with you as a human being, right? On all levels, right? It's doing the least amount of effort but producing the greatest amount of result. That's what anybody wants. That's what having a successful business is, right? It's building all of the great legacy, content, information, expansion, all of that, but not killing yourself in the process, right? So, and a lot of those pain points we see in healthcare, I know I did. I had a brick and mortar practice for 15 years, a family practice, and so it was really actually very amazing. It looked like a house. It had like 3 fireplaces. It was gorgeous, and just lots of fun and energy. Children, I absolutely loved being around that youthful energy. So once I get off the live, I'll see it so now that I see that once you've registered, I'll open up the access, and I'll send it to you. I'll be able to send it to you via email. I apologize about that. Thanks for letting me know. In that family practice, and, I saw over 40,000 patients, because when I crash landed in Virginia from Southern California, there was just a huge need for holistic doctors. And so I filled that role, and was very successful at it, and still am, and did literally all the things that I wanted to do in the field. And so for me now, it's about, passing on what I know and building, a strong network of people all over the world that are trained properly. It's very important for me for this practice not to die off, and also not to be colonized or to be, capitalized on, right? This is a very specific practice. Now, with that being said, the money does come, right? But that can't be the forefront of the discussion. It really has to be sincerely around helping other people, because there's a lot of things that are shiny in this field, and we have people's lives in our hands, and so we definitely want to respect that when we're practicing an oath to first do no harm. So we work with that, and so my vision is to really continue teaching these classes and build up. And this is something that I've been planning on for many years. This is not something that's just brand new. It's just how things line up, right, the way they do, and I love that, because one of my mantras that I use is everything is working out for me. And I love when things come together and things flow and things are divinely purposed. So this is just an amazing opportunity really for anybody that's interested in getting into the field of holistic medicine, and really, diving deep into it and really understanding it, and not just wanting to do it kind of in a gimmicky sort of way. So mommy, you would need to click the link in the bio. So if you click my link in the bio and you register, I can't manually send it because I don't have any of your information, But if you click the link in my bio and then scroll down, it'll say intro, register for intro to holistic medicine. And you click on that and you'll fill out a little form, right? And I apologize, there's a couple questions that are a little funky I have to fix. But you'll fill out the form and then it'll give you a thank you page and you can download the syllabus. And once you click on that, she said it'll give you a permission thing. I'll get an email about that and I'll send it to you from there. So that way, it's it's easier. That way I have all your info, and if I need to reach out to you for anything. So that's pretty much, about the practice. So a holistic health coaching certification takes about a year, because you really want to go through those different structures. Again, we build upon subjective and objective data. So you're just starting off with those 3 data markers in the first class, but then we start to build on that. And in its entirety, I can assess, again, physical data, which is really what we call remote patient monitoring. Also, what would be included in that is your biochemistry as well. So that's more of your physical aspect. And then environmental, it just depends on what we're looking for, what type of metric we're looking at, or what type of thing. But there's tons of functional testing that we look at when we're looking at environmental, as well as subjective questionnaires. We also look at bioenergetics as well. I talked about the biofield and talked about the Thera that we use, both as a diagnostic and a treatment tool, more for energy and bioenergetic frequency issues. Then we look at, brain assessment, so we can look at biofeedback, neurofeedback, QEEG. There's all sorts of different aspects of that we can look at. Then we look at, where are we at? Okay, emotional. So we look at a lot of the subjective data from that, and it really comes out, through the practice, right? Especially when we're looking at things like, eating, or looking at habits that have been formed. Because remember, all of our actions are based off of an emotional response, which is based off of something that we're telling us in our mind. That's going to be either subjective or objective that's either going to be subconscious or conscious that we're telling ourselves, right? And then it can drive primitive reactions with the nervous system. So we look at those aspects of the mind, and we can train different aspects of the mind, but also to really build emotional intelligence and emotional resilience, regardless of what's going on with our external circumstance. But it requires a lot of emotional regulation on your part, which takes a lot of time and effort and deconstruction. So away we go, physician, heal thyself, right? Spiritually, when we're working with people, it's not about religion. I work with people from all different religions. I've had the unique honor and pleasure of learning about so many different religions, and it's been just amazing. Like, I didn't know how many aspects of Christianity there were, or how many practices, of high spiritual faith that there are, but I've learned a lot. And when I'm working with a patient, because of my, again, public health background, I'm treating them based off of their culture, based off of their understanding. I'm not imposing my own will onto other people, so I'm really coming as a humble servant to these families and working with them. And so I've been able to learn about all kinds of things and work within boundaries and structures. I do have different elders that I go to for different religions that I'm not a part of. Like, I'm not a Christian, for instance. I was never raised that way, but I have a lot of insight into, different things to be able to stay within the context of somebody's religion. So religion is different than spirituality. Spirituality is more of like a person's walking with God every single day. And so it's more practical. And how we're walking with God is we're being more in our higher self, our more intuition. And so we're strengthening that relationship with a God of our understanding, and then, walking forward with that. When we're looking at ancestral, we look at genetics, we look at methyl genetics, we look at trauma, and how that has impacted the system as well. And so, yeah, it's a fascinating practice. Again, you learn a lot about yourself, you learn a lot about other people. And yeah, I've had just an incredible time working and helping so many people through their healing process, right? And so it's really about creating that container for people, for them to walk through and face themselves and go deeper. So yay, I love it. So all this week I'm doing info sessions, about 2 a day, in addition to my morning flow class in the morning. And then we're just getting everybody registered this week, making sure everybody's got their supplies and that kind of thing. I mean, realistically, with everything, less than $100 for your supplies. pH strips are probably like less than $10. You probably get them on Amazon for like $7 or $6 or so. You can also get them at various other places too, online, I'm sure. Then heart rate monitor, you can either use an Apple Watch, a Fitbit. Like I was telling people earlier, I got this one off TikTok Shop for $20. So, and then it hooks up with the Apple Health, so really good. Yay! I'm so excited for you. So, so we're doing that. And then Notion, just to keep everything organized for yourself. It's not required. And then obviously knowing how to use Google Drive, because I'll drop documents in there. We have a core shell already. It's built off of another platform though. I'm probably going to leave you guys in that little container, and then I'll move you when time comes. But there's a core shell which has the modules in it, and so we'll be working through the modules. I'm going to record the classes live on whatever platform you're streaming me on, and so everyone will have access to it. To get credit, you'll have to do the assignments, and obviously to pass the class and get a certification, you'll have to be registered and actually complete the assignments on time and receive an 80% or above for your whole class. So I didn't mention a little bit about my background. I think I mentioned more about my educational background, but I did teach anatomy, physiology, pathology, and kinesiology for many, many years. In fact, that's what helped me get through school, was teaching. And so I've taught at Kaplan, I've taught at Corinthian, I've taught at some private institutions as well. Yay, very cool, awesome. So I have taught at private and public institutions as well all over the country. I no longer reside in the United States. I live in the beautiful St. Lucia. And so if you continue on with me and you decide that you want to take this on the doctoral level, the doctoral level specifically and master's is more of a hybrid, and so you will be required for that program to come down to St. Lucia twice during the program. The program's 4 years, so through that time you'll come down and you'll learn about how we grow noni, or how we cultivate soursop, or how we cultivate sea moss, or how we use bush medicines or things like that. So you'll be able to actually get hands-on training and clinical experience down here in the beautiful St. Lucia once you get into a doctoral program. Let's see. Sorry to interrupt. Is oregano? Yes. So oregano oil. Yes, I would do oregano. So if you do oil, make sure that the oil is you can actually digest it, because not all of them are digestible. So oregano oil in a capsule form, about 500 milligrams 3 times a day, but you need a drainer as well. Echinacea can serve as a drainer. So you can get an echinacea tea, and then they have these zinc and elderberry lozenges that you can get, usually at like a health food store. You suck on those while, also drinking the tea. That should hit the throat pretty good. Also 4,000 milligrams of vitamin C, 50 milligrams of zinc as well. I think if you scroll through my videos, I do have a protocol somewhere I think like way back. I'll have to check and maybe move it into a playlist or something to make it easy for you. But vitamin C, 4,000 milligrams, 50 milligrams of zinc. Oil of oregano is going to serve as your antimicrobial agent, 500 milligrams 3 times a day. With a drainer, we're going to use echinacea as a drainer, so you'll do the tea 3 times a day with that zinc and elderberry lozenge. And drink that, and you're going to do that 3 to 5 days. Sleep and sweat. If you also need kind of an expectorant, if you need to kind of move everything up, you can use camphor, menthol, peppermint, or eucalyptus, and or on the chest with coconut oil. Coconut's really good for the immune system. Also behind the ears, underneath the nose, to really be that vapor. Don't use like a Vicks Vapor Rub, something like that, because it has petroleum in it, so it's not actually going to absorb and penetrate into the cell wall. So, yay. If you need more coating as well, like if it's a dry cough, there's a homeopathic Chestol that also is really good to kind of coat to get deeper down into the chest, because sometimes you just don't have enough productivity for it to come up. So, yeah, cool. So I'll be on for about another 20 minutes or so answering any of your questions about the course. The course is, again, a 12-week course, 3 parts to the course. Yes, of course. 3 parts to the course. It's foundations, where we learn about subjective, objective data. Also, we learn about the foundation of holistic medicine, and we learn about therapeutic order. The second week, we get into the modalities, so understanding the data and what we do with the data. And so we're going to look at the modalities of nutrition, movement, and mindfulness. And we'll get a little bit into natural remedies towards the end. So we'll look at that, and then we'll put it all together in our third part, where we integrate and do case study. And so we'll be practicing with each other, that sort of thing. 12-week course. At the end, you get a certificate of completion. If you want to move forward, we'll have that discussion in the last week. There is some supplies that are for the class. There's a technology fee of $39 times 3, so that's for the 12 weeks total, and then that's done. You can pay it in full, or you can pay it on a monthly basis, whatever you prefer. Also, you'll need pH strips, and you'll need a heart rate monitor. I was telling people you can get this one on TikTok Shop for like $20, and it syncs with Apple Health. Also, too, you can use an Apple Watch, you can use a Fitbit, a Garmin. There are several different tools that have heart rate. And so when we're looking at these aspects, we're looking at salivary pH, urinary pH, and we're looking at your heart rate. We're looking for digestion and your acidity levels within your stomach, how you're breaking down proteins. And then in urine, we're looking at oxidative stress, how your body's clearing toxicity, because your kidneys assist your liver in detoxification. Heart rate, we can look at lots of different markers, but we're just looking at stress and stress management. And we're going to teach you how to move your heart rate up and down. And so using that heart rate monitor and tracking it. So those are the metrics that we're going to be looking at, and we'll be looking at modalities and seeing actually how these modalities are modifying these numbers. And we'll put it all together. So it'll be pretty exciting. Thank you. Awesome. I appreciate you for that. So that's pretty much the class. And we start all this week. We're just registering people, and answering questions. I'll go on live actually later today as well to discuss, and we're getting everybody registered this week. I will post in the as students registrations come in, I'll respond and make sure everybody has the syllabus and what they need. And then we'll get everybody registered. We'll get everybody placed in the course shell and make sure everybody's where they need to go. And then from there, we will start on Sunday. I'll post everything for the week for everybody. So you'll also need to make sure that you can download the yes, you are so welcome. Yay, I'm so excited. I can't wait. And so we'll make sure that you have the apps to download on your phone, so you'll be able to do your discussions, and you'll be able to track your data. We'll go over your data every single week, so it'll be required for you to complete your data every day. So make sure that you do that. And yeah, it'll be really fun. We'll have a discussion going as well every week about, some aspect of holistic medicine that's related to the course material. It's not super heavy on the reading, I'll be honest. I will find some things for you guys to either read or watch that are pertinent, and I will give you some resources if you want to, you can purchase. So I actually, one of the resources that I have a PDF version of it, so you wouldn't need to buy the book because I have a PDF of it. That'll save you there. So and that will be our reference for our subjective data that we'll get into. So week 2, we get into subjective data, which is pretty much what the patient's telling you and their signs and their symptoms. So we'll work with a questionnaire, and that questionnaire has the resource to it, and then you'll be able to look and see that. So it's really exciting because you're going to get to see pretty quickly, the correlations with, your symptoms and how the body is working or not working. And you really start to bring health and healthcare to life, which is really fun. And that's why for me, I couldn't be a conventional doctor because it lacked so much creativity. I mean, I hate to say that, and I apologize, but I just could not be so deductive in the sense that it was only because in conventional medicine, they only have very little modality, right? So modalities are like your tools that you use, right? So in conventional medicine, primary modalities are medication, surgery, or a procedure. I mean, those are pretty much it. They also will stress on sanitation, so hand washing and things like that, inoculation, and then antibiotic. That's pretty much their methodology in treatment. And, people are really complex and deeply nuanced, and people come from all different backgrounds. I mean, I treat people from all over the world and all different ethnicities. And so, there's a lot of there's some similarities, but there's also a lot of distinctions too. So really the future of medicine is more personalized medicine, where, we're really fine tuning and we're really getting into, working with the individual, especially, good, bad. I mean, I know that it's a credible grief to watch our country, but with the advent of our healthcare blackout right now, this is needed now more than ever. Understanding your health data and what you can do practically instead of depending upon a system that has been broken for so long. And those that work in the system right now, my heart goes out because I know, COVID was very difficult, and this is even more difficult. And so my heart goes out. However, there are a lot of humans that will still need care and still need treatment. So now is really the time to focus. And, now is definitely time to get educated in this field because we are going to explode and need all hands on deck for sure over, the next several years between the all of the fast-paced traumatic events and, our food supply and our air supply and our water supply and all of the different things. Because while on one instance we're talking about, taking food dyes and additives out of food, on the other instance we also have environmental deregulations happening, because there's the removal from the Paris climate change and all of that, I don't know if I said it properly, but you know what I'm saying. So, there's some environmental issues that are going to really be prevalent. And so our bodies just really can't, sustain just with, what we're given alone. You are so welcome. So, we'll look at nutrition and the role that nutrition plays, when we're eating consistently herbicides, pesticides, GMOs, or we're eating foods that, are honestly dead. They're not nutrient dense, they're enriched, they're bleached, they're floured, etc. When we're eating all of this stuff, it creates a lot of damage into our GI system. Our digestive system houses majority of our immune system, hormonal system, and neurological system. So it's absolutely key and critical that we learn how to manage it. So we jump right in and learn how to test. This will just be one course, for instance, but there are going to be many different others. This is just one aspect of data. We can look at all kinds of different aspects of data when we're determining, what a patient actually needs. So it just can be really overwhelming for people because most people are not used to looking at data. Hello. So if you're interested in joining and registering for the class, you're just going to go ahead and click the link in my bio. You're going to scroll down, and then there's a link that says register for Intro to Holistic Medicine, or like it's shorthand or something. You click that link, you're going to fill out a little form. My apologies, there's a couple questions that are a little funky. Just disregard those. Fill it out, press submit. There's going to be a screen that pops up. It'll say click to the syllabus. Click on that and it'll request, and I will go through and then send you guys all the things that you need and all that. So this whole week is just registration week. So I'm going live and helping everybody through registration. Classes don't begin until next week. So you're good to go. Early bird gets the worm. So yes, and so it's a 12-week class. Feel free to ask any questions that you may have. 3 parts that we have in the class. We start with really the foundations of natural healthcare sciences and how we test and understand data, and then it's 4 weeks, and then we go into, so like history is first week, then subjective data second week, objective is third week, fourth week is therapeutic order, so understanding when you use what, and then second part is all about foundations. So we're going to, all about modalities. So we're going to work on nutrition and movement and mindfulness practice and a little bit of remedies. And then last part, we'll integrate it all in. I did record a video that goes more extensively, and you will get a copy of the syllabus. And then there's a course shell that you'll be able to enter into, and we'll put everybody in there, and you'll have your discussions and all the business, all the things. So, and I was just kind of chitty-chatting with you guys about the practice of holistic medicine. So if you have any questions about it, please do let me know. I'll be on live for about another 10 minutes, and then I'll run for a meeting, but I will be on later this evening to discuss and again, help people get registered. So I also teach a morning flow class every morning at 6 a.m. Eastern Standard Time. It is an hour to really get into the flow of your day. It's 15 minutes of movement, 15 minutes of meditation, 15 minutes of journaling, and 15 minutes of day planning. This month we're working on a 45-day prosperity meditation. We're on day 2 of that. And we're also working on the journal prompt of Who Am I? So we're really challenging the mind to begin to recreate itself. And that's our journaling prompt for that particular class. That class is not particularly needing to register. I will put a registration link, though eventually I'll get to it, and I'll put together a syllabus and all of that, but it's more of a drop-in course, and so you can just drop in, and it's streamed on all of the platforms that you're streaming me on right now. If you can see me, this is where I'll be. So, but just so you know, LinkedIn, my business Facebook page, my personal IG page, TikTok, and YouTube. So, and I think LinkedIn, I don't know if I said that or not. So, yeah. Wonderful. So yes, definitely. And I will be teaching the classes Wednesday at 7 p.m. Eastern Standard Time. That's a 1-hour block. And then on Saturday, a 2-hour block starting at 11. So 11 to, I guess, 1 in that area of the world. And so if you miss the live classes, as long as you're registered, you will get the replay. If you're not registered, you'll have to just catch the live class. So that's the advantage of being registered versus not. Also, too, you'll get a certificate of completion after the class is done. So, yes. Any other questions? Comments or concern? Oh, wonderful. I love it. Present. Yes. Let me know if you guys have any questions in regards to holistic medicine, the practice of it, the business of it, the patient care side of it. You just let me know if you have any questions regarding that. Where is everybody from? Where's everybody hailing from? Arizona, nice and dry. Vegas, nice. Vegas is nice. Nice and dry too. I like dry weather. I'm definitely a desert girl. I like the desert. Even though I'm living in, the jungle, rainforest. My skin, it was so wild. My skin started changing being in this climate as well. Originally from Chi-Town. I love it. And now living in North Kakalaki. Yep, I love it. Yes, I had a practice in Virginia for 15 years. So I treated a lot of people in North Carolina. Let's see, how much is the class? It is $39 a month for the 3 months. So 39 times 3 is the class, and that's your technology fee. So we have like a course shell that we put all the replays in. There's discussions, all of that. There's a way for me to grade you through there. And the, what else? There's something else. Oh yeah, there's an app that you'll be putting your own health data in, and so both of those tools is what you'll be. So the class starts on Sunday, right? So you'll need to kind of get everything figured out by Sunday if you can. That way you can get started. So, but if it needs to be like the first week, it's okay. You'll also need pH strips as well. Those can be bought, like they're a little less than $10. And then you'll need like a heart rate monitor. So if you have an Apple Watch, a Fitbit, a Garmin, something like that, I got this off of TikTok Shop for $20. And it does just fine. I tried it out a few months ago to see if it was legit, and it works just fine. So just something to track your heart rate. You could do it old school too, where you could like hold it and like the stopwatch thing, but just for ease of use, so. And accuracy too. I don't feel like counting, so I'm lazy. Yeah, so and then when you're ready to register, there's a link in the bio. Yeah, Brian, I really don't know how I feel about you, sir. You annoy me. I have to be totally honest with you. Yeah. I think it's the deductive. I just don't feel like I was ever really seen. I think that's the part. I think that's kind of the dynamic there. So, but I thank you for being gracious. I appreciate that. Yeah, so it's a 12-week class. It's done in 3 different parts. The first section is foundations, where we're looking at subjective, objective data. First week, we'll talk about kind of history and defining holistic medicine. And then we'll get into therapeutic order, so you can understand, what metrics you use and when, and, foundations and that kind of thing. So clinical understanding, so that you can keep yourself safe and also the patient safe. Then we'll get into modalities. We'll look at your nutrition, we'll look at movement, we'll look at mindfulness, and we'll look a little bit at remedies. But when we get into remedies, that gets really deep, so we're not going to go super deep into it, but we'll begin to play a little bit with that. And then we'll look at some case studies and integrate it, and then we'll talk about next steps and really the future and whatever your goals are in the field. I have relationships with Everglades University if somebody needs to do a bachelor's, But as the federal grant system has been, pretty much halted, significantly, me and another colleague of mine have other strategies to be able to access education at a more affordable rate if you need a bachelor's training. This is, I'm training you to be a holistic health coach eventually. And so you'll be able to leverage that and use that. No, it won't say anything about payment. No. It'll just, all it will be is a form, and then it will have a link to request the syllabus. That's it. And then once, so I will, because I kind of pulled this together, like what I'll do is that then I move you into the group, the course shell, and all that. Just bear with me as I do everything in sections, because I own a health tech company, and so things are there are a lot on the back end, so bear with me. I just kind of do a little bit at a time and relax and do a little bit at a time. It's very tedious, so I don't work as hard anymore as I used to. I used to bang out 18 hours and I'd be nailed in my computer. Now I go for walks and I breathe and I I meditate, that kind of thing. So any last questions, any last things before I run? I've got to go to this meeting. I will be on later this evening to chat with you guys about the course and answer any questions that you may have about holistic medicine and that sort of thing. Yeah, I do it kind of a little bit at a time. So all is well in the world. But I'm so excited that you're registered. Yay! So we're going to have a lot of fun, and we're going to learn a lot about the body, about how the body works, about how it all works together and integrated. And it's really, when you start to get into the magic of the body and the mind and holistic medicine, it's like, wow, it's absolutely profound. So I'm really, really excited, to be able to share and show you guys all the things. So I'll be on later this afternoon, probably like 5ish or whatever. Just set the bell. Like I won't give you an exact time, because unless I have like an actual meeting, I'm kind of fluid when it comes to the lives. And so unless it's like an actual designated scheduled class. So just these info sessions are just kind of loose. Whenever I have some time in my schedule, I'll pop in for like an hour. So I'll come on later because I moderate for other rooms as well. So thank you guys so much for attending this info session. There also is a video I just posted as well that goes over the entire course. Definitely listen through all of it. It goes over everything that I went over in this info session. It has a registration link. You can share it. You can like it. You can do all the things with it. So if you missed this info session, I will be on later today. So thank you guys so much for